Tackling non-communicable diseases, the way ahead. I am Dr. Srinivas Ramaka from Srinivas Heart Foundation, Andhra Pradesh, India. A non-communicable disease or NCD or non-infectious disease is a medical condition or disease which is non-infectious. NCDs are diseases of long duration and generally slow progression. They include heart disease, stroke, cancer, asthma, diabetes, osteoporosis, Alzheimer's disease, cataracts and more. Worldwide burden of NCDs. The burden of NCDs around the world is 85% in industrialized nations, 70% in middle income nations and nearly 50% in low income nations. The WHO reports NCDs, principally cardiovascular diseases, diabetes, cancers and chronic respiratory diseases to be by far the leading cause of mortality in the world, representing 63%, around 36 million of the 57 million global deaths as per a report in 2008. 80%, 28 million of deaths due to chronic disease occur in low and middle income countries, while only 20% occur in higher income countries. Globally, NCDs will increase by 17% in the next 10 years and in the African region by 27%. The highest absolute number of deaths will be in the Western Pacific and Southeast Asia regions. Every year, at least 5 million people die because of tobacco use and about 2.8 million die from being overweight. High cholesterol accounts for roughly 2.6 million deaths and 7.5 million die because of high blood pressure. 8 million die prematurely below the age of 60 each year in low to middle income nations from preventable causes which include tobacco use, unhealthy diets, alcohol consumption and physical inactivity. A large percentage of NCDs are preventable through the reduction of their four main behavioral risk factors, that is tobacco use, physical inactivity, harmful use of alcohol and unhealthy diet. Tobacco. Almost 6 million people die from tobacco use each year, both from direct tobacco use and second-hand smoke. By 2020, this number will increase to 7.4 million, accounting for 10% of all deaths. Smoking is estimated to cause about 71% of lung cancer, 42% of chronic respiratory disease and nearly 10% of cardiovascular disease. The highest incidence of smoking among men is in lower middle income countries. For total population, smoking prevalence is highest among upper middle income countries. Insufficient physical activity. Approximately 3.2 million people die each year due to physical inactivity. People who are insufficiently physically active have a 20 to 30% increased risk of all-cause mortality. Regular physical activity reduces the risk of cardiovascular disease, including high blood pressure, diabetes, breast and colon cancer, and depression. Insufficient physical activity is highest in high-income countries, but very high levels are now also seen in some middle-income countries, especially among women. Harmful use of alcohol. Approximately 2.3 million die each year from the harmful use of alcohol, accounting for about 3.8% of all deaths in the world. More than half of these deaths occur from NCDs, including cancers, cardiovascular disease, and liver cirrhosis. While adult per capita consumption is highest in high-income countries, it is nearly as high in the populous upper middle-income countries. Unhealthy diets. Adequate consumption of fruit and vegetables reduces the risk for cardiovascular diseases, stomach cancer and colorectal cancer. Most populations consume much higher levels of salt than recommended by WHO for disease prevention. High salt consumption is an important determinant of high blood pressure and cardiovascular risk. Cardiovascular disease. Globally, cardiovascular diseases are the number one cause of death and they are projected to remain so. An estimated 17 million people died from cardiovascular disease in 2005, representing 30% of global deaths. Of these deaths, 7.2 million are due to heart attacks, 5.7 million due to stroke. About 80% of the deaths occur in low and middle income countries. If current trends are allowed to continue, by 2030, an estimated 23.6 million people will die from cardiovascular disease, mainly from heart attacks and strokes. At least 80% of premature deaths from heart disease and stroke could be avoided through healthy diet, regular physical activity. Chronic respiratory diseases are diseases of the airways and the other structures of the lungs, including asthma and respiratory allergies. chronic obstructive pulmonary disease, occupational lung diseases, sleep apnea syndrome, and pulmonary hypertension. They account for 4 million deaths a year and mainly are preventable. The prevalence of these diseases is increasing everywhere, particularly among children and elderly people. The prevalence of asthma is increasing in low and middle income countries. Currently, COPD represents the fourth leading cause of death worldwide. Preventable chronic respiratory diseases cause premature deaths and disabilities. They also have large adverse and underappreciated economic effects on families, communities, and societies in general. Preventable chronic respiratory diseases are under-recognized, underdiagnosed, undertreated, and insufficiently prevented. What is the data regarding non-communicable diseases in India? Aging in India is occurring rapidly. The population above 65 is expected to increase from 4.4% in 2000 to 7.6% in 2025. Older populations are more likely to be affected by NCDs. NCDs now impose the largest health burden in India. In terms of the number of lives lost due to ill health, disability, and early death, NCDs, inclusive of injuries, account for 62% of the total disease burden, while 38% is from communicable diseases. Maternal and child health and nutrition all combined. NCDs largely affect middle-aged and older populations, the groups growing the fastest, which will lead to future increases. Cardiovascular diseases, injury, mental health, cancer, respiratory diseases, and diabetes are the major NCDs in India. As per WHO 2005, cardiovascular deaths were responsible for 29% of the deaths due to NCDs. During the year 2005, NCD accounted for 53% of all the deaths in the age group 30 to 59 years in India. Of these, 29% were due to cardiovascular diseases. It is estimated that by 2020, cardiovascular disease will be the largest cause of disability and death as a proportion of all deaths in India. Indians succumb to diabetes, high blood pressure, and heart attacks 5 to 10 years earlier than their Western counterparts during their most productive years. This leads to considerable loss of productive years to the country. It has been estimated that by the year 2030, India will lose approximately 17.9 million potentially productive years, which is higher than the expected combined loss in China, Russia, USA, Portugal, and Brazil. And this translates to a huge economic loss. The World Economic Forum has identified NCDs as the second most severe threat to the global economy in terms of likelihood and potential economic loss. The Millennium Development Goals state that health is critical to the economic, political, and social development of all countries, yet they contain no goals or targets for NCDs, the largest burden of disease in the low to middle income countries. There is strong evidence for the correlation between a host of social determinants, especially education and prevalent levels of NCDs and risk factors. Countries can reverse the advance of these diseases and achieve quick gains if appropriate actions are taken in the three components of national NCD programs. They are surveillance, prevention, and healthcare. Surveillance. Three essential components of NCD surveillance constitute a framework that all countries should establish and strengthen. These components are monitoring the exposures, that is risk factors, B. Monitoring outcomes, that is morbidity and disease-specific mortality, and C. Health system responses, which also include national capacity to prevent NCDs in terms of policies and plans, infrastructure, human resources, and access to essential healthcare, including medicines. Prevention. Prevention and control measures with clear evidence of effectiveness and high cost effectiveness should be adopted and implemented. Population-wide interventions must be complemented by individual healthcare interventions. Healthcare. Strengthening of country healthcare systems to address NCDs must be undertaken through reorienting existing organizational and financial arrangements and through conventional and innovative means of financing. The international public health advocacy in this area must be driven by one key idea. Non-communicable diseases are closely linked to global social and economic development. National policies in sectors other than health have a major bearing on the risk factors for non-communicable diseases. Throughout the life course, inequities in access to protection, exposure to risk, and access to care are the cause of major inequalities in the occurrence and outcome of non-communicable diseases. NCDs are caused to a large extent by four behavioral risk factors that are pervasive aspects of economic transition, rapid urbanization, and 21st century life. tobacco use, unhealthy diet, insufficient physical activity, and harmful use of alcohol. The greatest effects of these risk factors fall increasingly on low and middle income countries and on poorer people within all countries, mirroring the underlying socio-economic determinants. Among these populations, a vicious circle may ensue. Poverty exposes people to behavioral risk factors for NCDs, and in turn, the resulting NCDs may become an important driver to the downward spiral that leads families towards poverty. As a result, unless the NCD epidemic is aggressively confronted in the most heavily affected countries and communities, the mounting impact of NCDs will continue and the global goal of reducing poverty will be undermined. Improved healthcare, early detection, and timely treatment is another effective approach for reducing the impact of NCDs. The deliberations of the Calcutta Declaration under the chairmanship of Professor Amartya Sen opined that India lacks a primary healthcare system that offers effective and affordable protection to all against common illnesses. India's public spending on health, a little over 1% of GDP, is among the lowest in the world. This has led to an extremely high burden of private out-of-pocket health expenditures, which a huge part of the population cannot afford and which even fails to guarantee. Nearly every country in the world which has achieved anything like universal health coverage has done it through the public provision of primary health care, whether in Europe, Canada, or much of East Asia. Like in developed countries, India must either shift government health expenditures towards or increase absolute spending on prevention, screening, early intervention, and new medical treatments, reducing the burden of chronic disease. These measures are essential for the health of India as well as its economic progress. A program on disease prevention in general and NCD prevention in particular harbors on 3 A's: increasing awareness on health aspects, particularly NCDs, increasing access to healthcare services or NCD services, and making these services affordable to all. A concerted action by the government, administrators, policy makers, NGOs, and individuals is required to make the program of NCD prevention successful. Let us hope that the UN high-level meet on non-communicable diseases on 19th and 20th September 2011 at the UN in New York result in a final document which serves as a universal guideline for tackling NCDs worldwide. Thank you.